welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, and I appreciate it. Well, let's just go right to the questions, Jim. Could you touch on the topic of skin tags, and can you take care of them yourself? Can I, the patient, take care of my skin tags?
Well, skin tags are technically called acrocordons, and they're related to epidermal growth factor in the bowel. So it's something that a lot of us get. It does seem to be an inherited characteristic, and many people get them. And seems
related to obesity?
Obesity seems to make it worse, but there are certain people who are slim and still have a lot. In terms of treatment, the issue is they're easy to treat. The problem is that insurance rarely covers it. In my practice, I generally would just go in and remove them, either freeze them off or take a scissors and cut them off. But the frustration is that it's something the insurance companies say it's not an issue, we're not paying for it. Now, patients can do the treatment themselves if they're fairly aggressive person. You can take a sharp scissors and cut it. I don't think I could do that. Some people take a thread and tie it off. All of those possibly can work, but I think it's an issue where if it gets significant, you go to your doctor, but expect that you may have to pay the bill because insurance won't cover it.
Yeah, I just kind of get scissors. I don't even numb them anymore. I just alcohol them all, and then with the scissors, pull out the skin tag. Well, I have tweezers, and then with a sharp scissors, clip, clip. They go, ow, ow, ow.
Speed's an issue. If you go fast, it doesn't hurt too much.
Yeah. I get a tingling in my scalp, and it feels like blisters that pop up, but there's no blood or scab. What could this be? Blisters in the scalp?
Well, there's something called acne miliary necrotica, which is sort of like acne in the scalp. And you initially start out trying one of the medicated shampoos like a Tar shampoo or a Selsun shampoo, but if it's not working, you need to see your doctor. And they may have to treat it with an antibiotic for some period of time. Sometimes can take a couple of months, and it's not unusual that they might have to try 2 or 3 different products before they find out what works.
Right. If it's that, I mean, sometimes it might be something else.
Well, and they could be just scratching too, so you don't know. If they're a digger, they produce it themselves.
Yeah, some people, once you dig, then you've got an inflammatory process that perpetuates. What about Effudex? Do you use that? What is Effudex?
Well, Effudex is a topical chemotherapy drug that when you apply it to the skin, it will cause precancerous lesions to become inflamed, and it essentially destroys the lesions, gets rid of it. It's not the best product in the world, but it is the cheapest. And so the answer is we use it because the products that are better are not affordable. And the frustration is the people who need the medicine tend to be on Medicare, and none of the really good medicines are covered by Medicare. And in many cases, not even Effudex is covered by Medicare. So it's a good product. You have to use it appropriately because it can really cause a lot of problems if you don't know what you're doing.
And so a nursing home patient with a lot of pre-cancer, pre-squamous cell scaly areas, you rub it on once a day for about 2 or 3 weeks, and it gets worse and more angry and more angry and more angry.
Well, I tend to do it a little differently. Nowadays, what I do is I'll use it like 3 times a week, Monday, Wednesday, Friday. They don't get as red, they don't get as angry, and it takes longer. So we're not going to do this in a week or 2 weeks or 3 weeks. We're going to do it 3 months. But it gradually gets rid of it. They don't get as angry, they don't get as sore, and we still get a pretty good result. But we're still using the same medicine.
Yeah. Effudex, which is 5-FU.
5-fluorouracil, yep.
Yeah. Lupus of the skin. What's lupus of the skin?
Well,
let's talk about
lupus. Lupus is one of these autoimmune diseases, and that's an example of when your body's immune system is attacking the skin. And there are different kinds of lupus. So there's a systemic lupus, and there's what we call discoid lupus, and that's where it's only in the skin. And that can sometimes be treated with a strong topical steroid. Occasionally it might need an oral steroid. And then in many cases we use what we call immunosuppressive drugs because long-term use of steroids has a lot of baggage, and it's something we try and avoid.
So what does it look like? Is it,
a lot of times it's going to have a little bit of erythema and
redness.
A little discoloration, and it's almost like a purpura, but it isn't. It's a little different. Typically on the face, the scalp, usually sun-exposed areas.
Okay. And is it contagious?
No, it's an autoimmune disease. We don't know why people get it.
Okay. If one has eczema on the scalp, we talked about eczema before. It's just an inflammatory process. If it's on the scalp, what's the best way to do it without giving me greasy hair?
Well, you always start out with the basics, and so good shampoo can be helpful. The tar shampoos can be helpful. The Selsun shampoos can be helpful. Head and Shoulders, that's the start of it. And greasy things don't generally benefit it anyway, so doing that isn't going to be helpful. If it's not working, then you may want to go see your dermatologist because it could be psoriasis.
So leaving that stuff in the hair for a period of time, like it says to do, makes it important. That's important, isn't it?
You need to leave it in for, they say 15 minutes. Nobody does that, so maybe 3 to 5 minutes. And it does help, but if it's significant, go see your doctor.
Okay.
They can help you.
Father is 87, gets ulcers in the front of his legs, not due to pressure. What can be done to prevent these ulcers, sores in the front of his legs, and how should it be treated?
Well, this is one where unfortunately you're going to have to go see your doctor because there's a plethora of things that can do it. It can be related to diabetes, it can be an autoimmune disease, it can be trauma, it can be infection. So you really need, and absolutely, can be cancer, and I've been fooled on that several times. So many times you need to see the doctor, get a biopsy, and then go from there.
Those ulcers that don't seem to go away on the legs. Do you have a paper on tonight's show that we can purchase? Do you have any recommendations for good places for good information on the skin?
You can always try the American Academy of Dermatology. They have a patient site, so if you go on with your computer and look at American Academy of Dermatology, they will have various things there. And you can always talk to your dermatologist. They often have pamphlets they can give you.
Very good. Well, I want to thank you very much for being on the show. I know you're graduating from this last class, right? You're retiring?
Well, I'm my active practice is finished. I'm still going to be doing a little volunteering and also a little bit of travel to see the world. But you still want to stay involved in the world.
Yes.
You don't want to step away completely.
Well, we thank you so much, Jim.
Thank you.
Thank you very much. And thank you for joining us on our website. We appreciate all of your questions. Well, our Facebook spot. We appreciate your questions, the opportunity to answer them. Until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.